Hi everyone, welcome to the Momcozy Care Program. I'm Angelica Quezada, a licensed clinical social worker specializing in maternal mental health and a proud partner of Momcozy. Today, we're diving into a very crucial topic that affects many mothers, which is postpartum depression and anxiety. Our goal is to provide you with valuable insights and some practical advice to help you navigate this challenging time. Whether if you're a new mom, a returning mom, or supporting a mother, this video is for you. So the first question that we're going to ask ourselves is, what is postpartum depression and anxiety? Postpartum depression is a severe form of depression that can occur after giving birth. It can really affect your ability to take care of yourself and to take care of your baby. While postpartum anxiety, on the other hand, is excessive worry, excessive fears that can really interfere with your daily life. Both of these conditions are quite common. The good thing is that they're highly treatable. We just need the right type of support and the right type of resources, and we can start feeling better. The first step to help us get the support, to get these resources, is to understand and recognize what are these warning signs, what are the possible symptoms that I can experience. With postpartum depression, you might start to experience this persistent sadness, low mood, this feelings of emptiness, or even loss of interest in activities that you once enjoyed. Now, we understand you just became a mom, right? Or you have a little one. You don't have time for things that you once enjoyed. But even if you did have time, is that loss of interest still there? You might also notice changes in your appetite and changes in your sleep. Here again, we know you have a baby and your sleep kind of revolves around your baby's sleeping schedule, right? But here where we're seeing persistent impact in your sleep patterns and how you feel after you do get some adequate sleep. Feelings of guilt, worthlessness, or hopelessness might also be experienced. For postpartum anxiety, you might notice symptoms of excessive worry and excessive fear. For moms, of course you're going to worry. Of course you're going to be fearful of certain things and think about these things and worry about them. But we're talking about excessive, beyond the norm, every day, about everything, or maybe it's just one specific area, but it's this excessive worry. Okay? Restlessness, or like you're feeling like you're on edge all the time. You might also notice some physical symptoms, like racing heartbeat, dizziness, nausea, or even just difficulty concentrating. It's important to remember that these symptoms can vary in their intensity and the duration. And if you notice any of these signs, any of these symptoms, don't hesitate. Seek professional help. Talk to your OBGYN. Talk to your primary care provider, a counselor, a therapist, a social worker, a nurse. Seek some professional help to guide you on how to get the resources and the support that you need. In addition, understanding the risk factors and causes can also help you be a little more prepared and watch for some signs that might indicate that, hey, maybe I'm a little more susceptible to experiencing postpartum depression and anxiety. Some common risk factors for postpartum depression and anxiety can include a history of mental health conditions, lack of support, stressful life events, such as maybe struggling with infertility, or you had a really difficult pregnancy, or even maybe a very difficult labor and delivery, or it was traumatic, or any other highly stressful life events like new job, moving, getting married, right? But here also you might notice postpartum depression and anxiety because of the hormonal changes that occur after childbirth. the overwhelming feeling maybe of responsibility that you have, right, for caring for a new baby, for a newborn, can also contribute to some of these conditions. It really is a complex interplay of biological, psychological, social factors, but knowing this can really help you take some proactive steps and being aware whether you might be a little more susceptible to postpartum depression or anxiety, or even just start to recognize those warning signs and symptoms that you might be experiencing. Now, let's talk about what you can do. What could be some coping strategies and some self-care that you can incorporate as you're reaching out for support? Okay, the first thing and foremost is going to be reaching out for support. Talking to partners, family, friends, healthcare providers about what you're feeling, what you're going through, what you are experiencing, and not being afraid to ask for some help. Chores around the house, some of those things off your to-do list, or even for somebody to help you with the care of the baby. And of course, professional support is always crucial. So here again is where we're talking about counseling, therapy, support groups, talking to your primary OBGYN to get some of these referrals can really make a significant difference and help you in navigating this path. Incorporating some self-care into your daily life is also vital. And I know sometimes we put this in the back burner because we feel like we don't have time. And self-care doesn't have to be this elaborate plan. It can really mean just trying to include a little more rest, eating some nutritious meals, staying hydrated. If your body is physically ready for it, engaging in some gentle exercise like walking or stretches. Right? Check with your doctor if your body's ready for that. But really, it's these simple, small things that we can do mindfully and incorporate into our daily life that can make a big impact. In addition, we can incorporate mindfulness, relaxation techniques such as deep breathing exercises or meditation. And these can help manage the impact of the stress and the anxiety. One deep breathing exercise that I always like to recommend is called 478 breath work or breathing. And I would encourage you to Google it, find it on YouTube if you're interested. And this is a breathing exercise that really focuses on targeting some of that physical sensation that we might feel to send the right signals to our brain to help us get a little more calmness in that moment of intensity. And it's quite simple. It could be practiced at any time. It's a gentle, controlled inhale through the nose of a 4 count, holding it for a 7 count, and then an exhale, slow, controlled, and gentle through the mouth for an 8 count. And it looks something like this. So it's an inhale through the nose, hold for 7 count, 2, 3, 4, 5, 6, 7, and an exhale of a 8 count. And you can incorporate it at any time, maybe while you're breastfeeding baby, or in the middle of a shower, or right before you try to take a little nap. And remember, it's okay to take time for yourself, whether if it's enjoying a little bit of a hobby, or reading a book, or simply taking a nap. Self-care is not selfish. It's essential for your well-being and the well-being of your baby and your family. So now, to summarize, postpartum depression and anxiety are quite common, but very treatable conditions. It's important to start recognizing what are some of those warning signs and reaching out for support. Again, partners, family, friends, any healthcare provider, whether if it's healthcare or mental health provider, to get the right referrals and right resources for you. And remember, seeking help is not a sign of weakness. It's a sign of strength. So we want to thank you for watching this video and for supporting breastfeeding moms all over the world. Your well-being is really our top priority here at Momcozy. And if you found this video helpful, please like, comment, and share it with other moms who might benefit from this. Join our Momcozy Facebook group for additional support and resources. And together, we can start to create a more supportive community for all moms. Take good care of yourself, and we hope to see you in the next video. Goodbye.
Cozy Power by Momcozy.